Today we are covering calcium and magnesium imbalances, a topic the NCLEX loves to test through patient scenarios that require you to identify subtle signs and prioritize actions. Remember that the primary role of both calcium and magnesium in the body is to act like a sedative for neuromuscular function. The more calcium and magnesium you have, the more sedated the muscles and nerves are. The less you have, the more excitable and irritable they become. This single concept is the key to answering most questions correctly. Let's start with hypocalcemia. The exam will give you a patient, often one who just had a thyroidectomy, and describe symptoms like tingling around the mouth or numbness in the fingers and toes. They are testing if you can spot these early signs of low calcium. Your next step, and a common question, is to assess for Chvostek's and Trousseau's signs. For Chvostek's, you tap the facial nerve, and the cheek twitches. For Trousseau's, you inflate a blood pressure cuff and the hand develops a carpal spasm. An easy way to remember this is Chvostek for cheek, and Trousseau's involves the arm where you'd wear a t-shirt sleeve. If these signs are positive, the patient is at high risk for tetany and seizures, making seizure precautions a priority nursing intervention. Now let's flip to hypercalcemia. Think of a patient with bone cancer, which causes calcium to leak from the bones into the blood. This patient will present with signs of sedation, such as profound muscle weakness, lethargy, constipation, and decreased deep tendon reflexes. The NCLEX trap here is that these symptoms can seem vague. The question will focus on your ability to connect them to hypercalcemia and implement safety measures due to weakness, encourage hydration to prevent kidney stones, and promote ambulation to help calcium return to the bones. Here's a critical point where the exam tries to trick you: the relationship between calcium and magnesium. They act as partners. The signs of hypomagnesemia are almost identical to hypocalcemia, including a positive Chvostek's and Trousseau's sign, muscle cramping and tremors. The classic scenario for hypomagnesemia is a patient with a history of chronic alcoholism and malnutrition. If a question describes a patient with tetany but a normal calcium level, your next thought should be to check their magnesium. For hypermagnesemia, the causes often point to renal failure, where the patient can't excrete magnesium, or they've been overusing magnesium-based antacids. Just like hypercalcemia, this leads to sedation. The hallmark signs are decreased deep tendon reflexes, hypotension, and the most life-threatening, respiratory depression. If you see a question about a patient with renal failure who is suddenly drowsy with a low respiratory rate, hypermagnesemia should be high on your list of possibilities. The priority nursing action is to monitor their breathing and have the antidote, calcium gluconate, at the bedside. The exam loves to test this antidote relationship. A simple mnemonic to keep it all straight is to think of the prefix. Hypo for both electrolytes means high excitability. Think tetany and seizures. Hyper means high sedation. Think weakness and respiratory depression. Master this core concept and you'll be able to reason through any scenario the exam throws at you.